Hi, I'm Sarah Jo Fauché, and I'm the Executive Director for Mercy Care, formerly Mercy Hospice and Palliative Care. We've created this video to help dispel some myths and misconceptions about what hospice is and what hospice does. Let me share a few of these misconceptions for you. Hospice is only for cancer patients. Hospice is only for old people. Hospice is only for the wealthy. Hospice means that I'm giving up on myself or my loved one. Hospice is needed only in the last few days. People come to hospice when all hope is gone. These misconceptions are wrong. Hospice is not about giving up. Hospice is about affirming life and making sure that patients are pain and symptom free so that they can enjoy whatever time it is they have left. When a patient chooses hospice and Mercy Care, the focus changes from the disease and the process of the disease to a focus on the patient's goals and their quality of life. This part of the life experience holds the highest potential for healing, and it's Mercy's mission to help you experience that. Hospice services include a team of professionals, a physician, a nurse, a certified nursing assistant, social worker, chaplain, volunteer, and grief counselor, and they're all here for you. Members of the team will come to you as often as needed to meet your unique needs. They're there to teach and support the caregiver to help better care for their loved one and to keep them comfortable. Mercy Care adjusts to the patient and family. We'll come and visit you at a convenient time for you, wherever you call home, whether that's in an assisted living facility, a long-term care facility, a private residence, or a hospital room. Hospice is not only for the wealthy. In fact, hospice services are basically provided by Medicare, Medicaid, and private insurance with little or no cost passed on to the patient and family. Mercy is committed to caring for individuals who have need regardless of their ability to pay. We understand that there are many myths surrounding hospice care. But in fact, patients who have hospice services actually live longer and have a much better quality of life than those who don't use hospice services. Let us tell you a little bit more. Our mission is to comfort the body and heal the heart through competent care, which focuses on supporting and nurturing the human spirit and preventing and relieving suffering, one person, one family, and one community at a time.
Sooner than later. Let us come in. If the patient does phenomenally well, and as I said, patients improve on hospice statistically. If they do phenomenally well, we can discharge you. We have graduates. We have people that are discharged. If they become ill again, we go back and they become a Mercy Care patient again. So my one message would be sooner than later. It's a phenomenal support system. And we can add to the quality of their life much sooner than we often are able to because we don't get in there early enough.
Most people, as a goal that they state, say, you know, if I had my druthers, I'd rather be at home than be in the hospital. And so we design a program of care that tries to provide for them what they need at home that they would get if they came to the hospital. And then you don't have to choose between one and the other.
The way I envision it is kind of like these arms that go around the family, this safety net that's present. I can speak from a personal perspective too. My grandmother had dementia, she had Alzheimer's, and even though I was a nurse, it was a whole new road for me to go down. You think you know what's going to happen, but it's a whole different avenue when you're dealing with it yourself. What I felt from being on that side of it was I felt the security of knowing that I had that safety net under me, that I kind of knew what I was doing, but I had those people that I could call.
I think the biggest thing I always mention to my patients, especially in the hospital when I'm seeing them, is, we're not giving up hope. We're not saying that your loved one is going to die in the next 6 months, but if they do, let's make a plan. And certainly if they get better and we need to discharge them from hospice, we will rejoice in that with you. But let's at least make a plan in case that isn't the road that's before your loved one.
Hospice and Mercy Care is not a business that closes down. You know, we're not a business that can shut the doors, because the patients need us 24 hours a day, 7 days a week. And we need to be there because that's that safety net. That's that patient's family knowing that if they have a crisis, there's always somebody they can reach out to. That gives them enough confidence and enough self-assuredness to know that they can do this and they can take care of their loved one in the home.
I really enjoy the nonprofit aspect. I think a lot of the patients we take care of are uninsured, underinsured. Unfortunately, in the competitive market, that is important, but not so much for Mercy Care. You know, we take care of everyone. We don't necessarily look at that.
As Dr. Tarbett said, it's a nonprofit, and I've seen people without insurance and all kinds of walks of life be taken care of. That's very appealing to me because I think there's a lot of inadequacies in care for certain races of people, and if someone doesn't have insurance, they don't get care equally, and everybody's treated equally at this organization.
We have a practice here that once we receive that contact, we are back and starting that process, and we have a face-to-face within a 3-hour time frame, because we understand when somebody's calling us, when they're putting up that red flag, that white flag for help, whatever, it's because they need us now. They don't need us 2 days from now, 3 days from now. They are searching. Usually they're at their kind of end of their rope and they're looking for assistance. So we get right in there, and we will evaluate the patient, talk to them on the telephone, and then we'll actually send a nurse out there to do a pre-admission, to interview them if we're not sure if they meet criteria, and get the process started immediately. And that's 7 days a week, 24 hours a day.
And most of the time it's just relief. A relief that the patient is no longer suffering, relief in they did make it through the process, and just joy. Most of the time people get those issues unresolved that tend to make death so hard. Past hurts, or making sure they said what they needed to say because someone told them they should. A lot of joy, and thankfulness, just so grateful for everyone helping them. And you know, that's the part that really gives back to us and encourages us to keep going out and doing it more and more.
Mercy Care means to me the embodiment of those two words, mercy and caring. They come in and graciously, with mercy, give the finest care to their families and their patients. And they allow people to have the best quality of life and to maintain or even enhance the dignity of their life.
Hospice was there for all of us. I found hospice to be honest, dependable, and the very best.
I would always recommend Mercy Care to anybody, but I can't stress enough that it's important that you contact Mercy Care sooner than later. We made that decision, and with your help, weren't even sure that we would qualify to use Mercy Care, but we obviously have, and it's been a blessing to date.
We hope we have answered some of your questions about hospice and the exceptional care you'll receive with Mercy. Since 1981, we have been serving our communities, and it is our honor and privilege to serve our patients and families at this most challenging time. I'd like to close with something we most often hear from our patients and families, and that is, we wish we had called Mercy sooner. Many of our patients and families don't receive the full scope of services that we provide because we just didn't get the call soon enough. If you are suffering a life-limiting illness and you're considering hospice, please don't hesitate to call. We know that you have a choice in your hospice provider, and we'd be honored to be your choice. Contact us anytime, 24 hours a day, 7 days a week, 365 days a year. Mercy Care is here for you.